It sounds like you're about 13 weeks along and experiencing a little bit of pain, and this can be normal. As your uterus grows and stretches, you can have what feel like growing pains. You might feel a little bit of stretching, maybe a tiny bit of mild cramping, but it shouldn't persist and it shouldn't be intense. If that ever happens, then be sure to call your OB provider and let them know how you're feeling. After asking you more specific questions about your observations, they can decide if anything else needs to be done about it. They might even want you to come in so that they can perform an exam. Of course, whenever any preterm woman experiences pain, we always want to rule out complications like preterm labor first. And signs of that can include lower abdominal cramping, lower backache, an increase in vaginal discharge, any bleeding or spotting, or leaking of fluid from the vagina. If you ever experience any of these symptoms or are just concerned, don't ever hesitate to call your OB provider, because they can decide if it's something that needs to be addressed and if it's something to worry about, or if it's just something that you'll have to cope with throughout pregnancy because it is due to normal aches and pains. I hope the very best for you and that things go well during your pregnancy. And if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.